Hello. I have to say that I am very happy to be here. This is actually my second meeting, and I think I've watched about 3 of the go-to meetings since I've been here. I consider myself a newbie. I'm still a toddler. I've only been in Spokane for about 19 months, and when I get to the 24-month stage, then I'll start telling everybody I've been here, and we'll kind of speed things up a little bit. When Travis first asked me to speak, he mentioned something about lessons from Texas. And there's a lot of lessons that I could share, and I've tried to select some of those today to share with you from some of the emergency management opportunities that I've had. While I've been in healthcare a lot longer than I actually care to admit to any of you. I've been on the ambulatory side, which I am now. So basically, I'm going to be speaking just to Rockwood Clinic. We have our sister hospitals at Valley and Deaconess, but I'm going to be speaking to the ambulatory care side of things today. And how important I believe that piece is to emergency preparation and response in Spokane. I do call myself a native Texan survivor. That's because I have huddled in closets with pillows and my dog and a radio and water and my phone. And I've also sat in bathtubs and done the same thing. And I think most people who are true Texans have actually done just that. This is just a little bit of background about Rockwood Clinic. Obviously, we're a multi-specialty physician group. We do ambulatory, primary care, as well as specialty care. We have 6 urgent cares in the area, and we also employ a number of hospitalists that then help staff our hospitals, sister hospitals. You can see where our locations are. And the reason we do that, I say, is for the patients that we serve. But we are the largest freestanding outpatient diagnostic and treatment center between Central Washington and Minneapolis. Our statistics are there. We've been around for quite a while, and pretty soon that logo is going to change to Multicare Rockwood come July 1st, and we're extremely excited about the possibilities and the partnering and what they're going to bring to the Spokane community. This is sort of a Texas map of the United States. That helps. And if not, I can hold the other mic. I'll do all 3. The reason that I put that up there is because everything is bigger in Texas. So I had told Travis I might go over just a tiny bit for my 10-minute time frame, but also because this kind of shows Texas in the dead center of the United States. And when it comes to living in Tornado Alley, that really does feel like we go all the way up and that we are smack dab in the middle of things, as we say. You wouldn't know it by looking at this photograph, but this is actually what we consider to be a disaster site. It's a linear parkway. There have been 3 floods in this area when I was living in Texas. And unfortunately, my parents' house was right back in here. And all of those homes were eventually bought out by the city. They were raised, and it's now a linear parkway. There was everywhere from about 6 inches of water at one flood to 4 feet in another. And that's when they decided that Johnson Creek could no longer be corralled and that we needed to do something about it. So it's now a linear parkway, and it changed the watershed, which is actually the reason why we had all the flooding to begin with. But that was quite a thing to go through. And the community responding to that is part of what kind of got me interested in emergency planning and management. This is Delta Flight 191. I don't know if many of you are familiar with this one or not. It happened in August of 1985 at DFW Airport. It's the most severe crash and incident that they've had there. 136 people were killed. That includes the flight crew as well as passengers and the person that was driving their car on Highway 114 when the engine flipped it as it was coming down. This was the result of a microburst, something that people in Texas are pretty familiar with. I don't see a lot of that around Spokane. When I got here, I asked if there were tornadoes in this area at all, and people laughed at me. And right after that, I heard that there was one spotted over Airway Heights, I believe, and I went, I guess I brought it with me. This was a significant challenge to the Dallas-Fort Worth area in terms of responding as a community. I was working at St. Paul Medical Center at the time. We initiated our emergency response training and our planning, expecting to get a lot of survivors injured and so forth. There were only 27 people that were either carried or walked away from what was left at the tail of this airplane. Interesting enough, it changed a lot of the way flight crews or crews are actually trained. They used to be trained to cope with microbursts, otherwise known as wind shear, and now they are taught how to escape it, how to go around, how to get out of it, and that type of thing. That was one of the major changes. The other thing at the time is that there was no Doppler radar. It was mature and ready to be implemented. It just had not been implemented yet. So there wasn't any real-time identification of the little mild thunderstorm that was just to the north of the airport. You can tell it wasn't even a rainy day. The temperature was 101 though, and in Texas, as sultry as that can be, we had a cold front move through. And when a cold front hits with that warm air, things happen. This is Mayfest, a result of Mayfest. This occurred in 1985, and at that particular point in time, hail damage occurred about 7:30 at night, and the size of the hailstones were anywhere from about 3, 4, 5 inches in diameter. It caught everybody off guard. There were about 10,000 people out along Trinity Park in Fort Worth enjoying all the things that come with being outside and enjoying the weather. There were 400 injuries. 90 of those had to be treated at our area hospitals. As you can imagine, with hail that size, not only were there broken windshields, but we had lacerations, we had broken bones, and a lot of people went to their cars with storms. You don't do that in a tornado because you'll get picked up and tossed around. But people try to get in their cars to protect themselves, and this is the result. We have a lot of injuries, again, from the broken glass. At the time the storm occurred, it was actually the costliest U.S. history hailstorm. And it actually caused more than $2 billion in damage. It occurred from a supercell. Supercells are known to have their updraft and their tornado activity in them. And after the storm moved over and the squall line caught up with it, another 13 people were killed just from the lightning and the flash flooding that occurred. This was another interesting lesson. All of the 911 lines were jammed because people were so caught off guard and out without any protection. And so it's actually changed the way that the emergency management system in Fort Worth responds now to all outdoor activities, whether it be in the winter, spring, summer, whatever in Texas. They work very closely with the National Weather Service, and they've set up what they call RACES, and I want to get this acronym correct. It's the Tarrant County Radio Amateur Civil Emergency Service. And again, they're now at all of our outdoor events there so that they can help communicate when the weather takes a turn, which it's quite known to do. This is the actual size of some of the hailstones. Everything is bigger in Texas, like I said. Not always a good thing. This is from March of 2000. This was another quite interesting event. This is after it was hit by an F3 tornado. The tornado touched down about 6:30 and was only on the ground for about 10 minutes, but it covered a 4-mile long and a 250-yard wide area through downtown and the surrounding areas. So we had about 250 homes that were destroyed, and or 28 that were destroyed, and about 250 that were actually damaged. The building here that you see, this is the Bank One Tower. Up here at the top was a very nice restaurant. Those people had to climb down 35 flights of stairs in. We thought emergency lighting. Some of it worked, some of it didn't. This building is the remnants of a church tower. And if anybody ever says to you that in a tornado you go to the lowest, their prayer tower, and all that was left after the tornado was the stairway, and obviously the top of the church is there too. And then we had other buildings that were pretty well destroyed. This is the Cash America building, and I put this up here because it was amazing to all of us who lived in that area. Mansfield, Texas is about 20 miles from Fort Worth, and a lot of the documents that were blown from this building ended up being found in Mansfield. At that time, I was working for Cook Children's healthcare system, and we had a board meeting going on. I don't know if there are any providers present today, but it is a well-known fact in ambulatory care, at least, that sometimes working with providers is akin to herding cats. And that was the one time I can remember I did not have to tell them twice to get up and leave the room and go down and get in the basement when all the sirens started going off. We did get a lot of children into the ER because of the broken glass. The Bank One tower that I spoke about lost about 80% of its 3,000 windows. It took about 2 years for that building to get back and open up again. This I wanted to show you too. This is also from the same tornado. What you see in the front right here is a billboard, and it used to advertise for a savings and loan company, and we call it tornado art, and we've just left it there because the tornado obviously demolished the sign and bent it and twisted it. And then the post office, which is the building there, decided that they would put their creed on the outside of the building and just make it an art piece in downtown Fort Worth. These are, again, just some of the implications of what happens when you have something that devastating coming through. We were lucky. We had 80 injuries and only 2 fatalities. That's a good warning system. I had the pleasure of working with John Solano at Rockwood, and John asked me one time if it's true that in a tornado, cows actually get picked up and fly around. I'm sure they do out in the rural areas, and yes, there are longhorns in Fort Worth. They get paraded down the old town every now and then, but these are actual tractor trailers. This occurred about 1:30 in the afternoon. It's along I-30 that connects Fort Worth and Dallas. This was just before the Dallas city limits. The tornado had touched down. As you can tell, it looked like nighttime, and it tossed these things around. This is from a news helicopter. We're talking about how it looked like Legos being tossed up into the air. And then this, to me, is a very hard lesson and a very sad one as well. What you're seeing here, this is the remnant of an apartment complex. This is a nursing home, and all back on either side are homes. This is West Texas, not the geographical location, but West Texas. It's about 20 miles north of Waco. Most people here, I've noticed in Spokane, know of Waco because of the Fixer Upper show. And I have to tell you, a native Texan calls Waco wacko for a lot of reasons. But this was really a tragic event that occurred on April 17th, 2013, when the West Fertilizer Plant exploded. This is actually a farming community, and it really brings home to me the message of why we have to prepare in the big cities for those in our community, and how we are all partners and we're all connected. Waco's not a very big town either. It's smaller than Spokane. And they had to take the hit from all the injuries that came with this devastation. About 40 people were admitted to the medical center there. Some others were actually taken to one of the other hospitals. There's 2 hospitals in Waco. This is interesting to me too. This was their makeshift triage area. This was the football field at one of their schools. They weren't prepared for anything of this size. It literally decimated their response to any kind of an emergency. And the sad part to this story is that it killed 15 of their volunteer first responders. The fire was the initial call, and the fire department went out thinking that it was just handling a fire at the fertilizer plant. The difficulty here is that the company had been storing ammonium nitrate right next to other combustible materials. and when the fire caught, it caused other things to catch fire, and then the explosion resulted as they were fighting the fire, and that's with their EMS, their entire EMS response team was killed. You may remember the Obamas came to the memorial service. This was a major hit for Texas. West is a lovely little town. It's known for its Polish heritage and its Pilates. A lot of people all around Texas have visited there, and it really did pull the community at large together. Texas came together, the nation came together, and it was very difficult for these folks because it happened at the same time that the Boston Marathon bombing had occurred. So, you know, that was kind of a, who's going to pay attention to us? And a lot of people did respond. Patients had to go all the way to Dallas. That's where the burn unit is. They went to Temple, Texas, which is about an hour away, and any place that Dallas, Fort Worth, any place that was the appropriate place to go. The company had warned state and local officials, but they had not warned the federal officials that they were storing the chemicals in this manner. So there was no need, apparently, to come out and investigate or audit or survey. And the Chemical Safety Board reported that the response to the fire was actually flawed because they did not know that there were things on site that could be detonated. And they also said that what should have happened was there should have been plans for an incident command center, which kind of brought things home to a lot of us. Texas has taken steps to prevent this from occurring in the future, but it's one state. It's not something that's been implemented at the federal level or across all states. I don't know personally what Washington requires, but to me that's something to think about, especially last year when federal authorities actually announced that this was arson, that the fire was deliberately set, and because of the lack of planning for what was actually on site, a lot of lives were lost. So that's my history in Texas, and then I moved to safe and sound Spokane. And this was my second day here. And I was like, why is everybody getting so upset about a little windstorm? And then I realized there's big trees here, and I saw the devastation, and I heard the stories about what had happened to Rockwood Clinic and all of our locations, which are out throughout Spokane, and just what devastation can be caused just by windstorm. So that kind of got me thinking, and I met with John, and we talked about emergency preparedness and our response, and we got our group together, and we went over our plan, and really kind of did an exercise on what did we do well, what could we have done different, that type of thing. And then I got to looking at I-90, and I thought, wow, this is a freeway, and it actually connects the East Coast and the West Coast. I wonder what's in the trucks that go up and down that freeway all the time, and what planning is there around that? That's a big deal in Texas. We have a lot of loops, and there's a lot of bypasses that trucks have to take because of their cargo, and I don't see a lot of loops and bypasses here in this area. Then I had to learn about wildfire and fire season, and that's apparently already started this year, which seems earlier to me than last, but then spring seems to be really late here as well, so I'm very confused as a newbie to the state. But wildfire is something that happens in West Texas. It doesn't happen much in the true urban areas, but that kind of got me thinking about, so what's the emergency response plans for all of that? And then I noticed there's a lot of train tracks around here. I live up in Eagle Ridge, and every morning I get to drive past the convergence where they go over the highway and, you know, come through downtown Spokane. That got me thinking. And then it hit me one day that, wow, okay, there's a volcano here, and I know that it damaged a lot. What did it do to Spokane? And I realized, okay, what happens on the west side can definitely impact the east side, and the planning required for something of that large proportion. And then this year, with the influenza epidemic on the west side, it kind of brought it all home to me that what does impact the west does impact the east. When I found out quite by accident that the Deaconess plan and the Valley Hospital plan for diverting patients during an epidemic, who don't need to be hospitalized or truly be a part of the ER, impacts our urgent care, that they're on diversion to us. I didn't know that until I just happened to see it. And interestingly enough, others in the C-suite didn't know that either. So that really brought it home that we've got to be a part of the community. We've got to broaden Rockwood's look and really partner with everybody else to decide exactly what it is we should be doing. And then the good news was I realized other people had the same concerns I did. When I saw I don't know what they're called, but there were the grannies that got arrested for trying to do something about the train traffic through town. So I thought, okay, well, I'm not alone in all of this. And I was reaching out to Travis and Spokane Regional and trying to figure out exactly what we needed to do with our actual preparedness at Rockwood about the same time. And I'm glad that Ed brought up the mission today, because to me, collaboration and participation is what it's all about. And to me, at the very core of that, it's just simply people helping people, right? That's why we're here. And to me, the important pieces of the mission are to prepare for, respond to, and recover from crisis using all available resources. So I want to put Rockwood out there. I want to do the right thing. I want to do what it is that we need to do to help you all and all of the people here in the Spokane community to be safer and to help them in a crisis, and hopefully to prepare to avert those crises as well. And I want to leave you with this last picture today. This is the one that kind of really drove it home for me. And these pictures are all online, by the way. It's kind of interesting. But this is their education building. And you know, you've got your main corridors coming and your train tracks again going right through the city. And I wonder what would happen if something happened along the train tracks and who could get to what. You know, do we have plans out there that, you know, connect different parts of the city? I know every way there is possible for me to get to work. That's just something I've done no matter where I live. There's not a plan A and a plan B. There's a C, a D, and an E that go with it, and I've done the same thing here. I don't like sitting in a room with my back to the door. I want to see who's here and be very aware of my surroundings. I'm careful what I wear on airplanes and where I sit on airplanes and who gets on the airplane with me. All of that that's going on with our cultures and our societies these days has made us all very aware of our personal safety. And this, to me, is just a bigger picture of that. It's our community. It's our neighbors. It's our patients. It's our friends. So please keep up the good work. The collaboration that I have found working with Travis and Spokane Regional and Region 9 has been wonderful. And Rockwood is very committed to continue that. Thank you.